My name is Nabil Adra. I'm an assistant professor with medical oncology at IU Health. So testicular cancer is the most common cancer among young men, usually ages 15 to 35. Patients who are diagnosed with metastatic testicular cancer are usually cured with cisplatin-based combination chemotherapy. These cisplatin-based combination chemotherapy regimens were pioneered here at Indiana University over 40 years ago. Unfortunately, there's about 20% of patients with metastatic testicular cancer where the cancer relapses after first-line combination chemotherapy. For those patients with relapsed testicular cancer who have anatomically confined disease, we usually recommend surgical resection by an expert urologist. However, the majority of these patients will relapse with advanced disease and possibly with rising tumor markers. With those patients, our preference and recommendation here at IU Health is to proceed straight to high-dose chemotherapy and peripheral blood stem cell transplant. We are treating patients with relapsed testicular germ cell tumors with high-dose chemotherapy and peripheral blood stem cell transplant. This approach started here at Indiana University back in 1986 when they were using bone marrow transplant for those patients. And we showed that we're able to cure a certain number of patients using this technique. In 1996, peripheral blood stem cell transplant replaced bone marrow transplant, allowing for more effective delivery of this treatment and allowing us to achieve better cure numbers. In our first series of 184 consecutive patients, which was published in the New England Journal of Medicine, we showed that when high-dose chemotherapy is used in the second-line setting, we're able to cure about 70% of patients with relapsed testicular cancer. And when this is used in the third-line or subsequent setting, we're able to cure about 45% of patients with relapsed testicular cancer. We think that high-dose chemotherapy is effective in those patients because we know that testicular germ cell tumors are chemosensitive tumors. The majority of those patients are cured with first-line cisplatin-based combination chemotherapy. For the minority of patients who are not cured with first-line chemotherapy, it's not a matter that those tumors were not sensitive to chemotherapy. It's just a matter that we think that those patients did not get enough intensity of chemotherapy, and that's why our preference is to move to high-dose chemotherapy in this patient population. I think testicular cancer is a success story in oncology. For the majority of patients, we are able to cure those patients with first-line chemotherapy. However, patients with relapsed testicular cancer have very complicated clinical scenarios. Those patients typically have rapidly progressive disease, and they tend to be quite sick. Our recommendation here at Indiana University Health is that those patients be seen at a center of excellence for testicular cancer, such as Indiana University Health. The multidisciplinary approach to those patients is very important, and most importantly is moving very quickly to high-dose chemotherapy and peripheral blood stem cell transplants, and therefore achieving the best chance of curing those patients. In addition, it's very important to offer modern supportive care for those patients while they are receiving the high-dose chemotherapy and stem cell transplant in order to lower the complication rate of this high-dose chemotherapy. We at Indiana University Health were the first to treat patients with relapsed testicular cancer with high-dose chemotherapy and stem cell transplant. We have over 30-year experience with those treatments, and over those 30 years, we have treated more patients than any other center with high-dose chemotherapy for relapsed testicular cancer. Over those years, we have perfected the use of high-dose chemotherapy, and we have learned how to navigate the treatment, the toxicity, and the long-term outcomes of those treatments. We have a very strong collaboration with referring providers for patients with relapsed testicular cancer. Typically, we see patients very quickly after they are referred here to Indiana University Health, and if needed, we proceed very quickly to high-dose chemotherapy. Once patients are treated and complete their high-dose chemotherapy, we send those patients back to their referring oncologist so that they can continue their follow-up locally closer to their homes. Providing optimal treatment for those patients will hopefully achieve cure and allow those patients to live their normal lives, which could be 40, 50, 60, and sometimes 70 more years of life. And I think that this makes testicular cancer a very unique situation where patients are targeting cure and not just prolongation of life by their chemotherapy. Our overall goal here at Indiana University Health is to offer the best advances for patients with testicular cancer. from new biomarkers in patients with localized disease and early stage disease to high-dose chemotherapy and stem cell transplant in patients with relapsed testicular cancer, and going to new clinical trials evaluating new drugs with refractory patients with testicular cancer. Our goal is to cure every patient with testicular cancer in the future.